Hi everyone, this is the interior of the base of the skull, which we call the cranial fossa. The cranial fossas are naturally demarcated, so no need to draw any imaginary lines. We can divide the cranial cavity into three parts: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. So, in this video, we will learn about the anterior cranial fossa alone. So, on each side, the fossa is formed by the roof of the orbit. These are the roof of the orbit. And in the midline, it is formed by the roof of nasal cavity. Let's see the features of this part one by one. On either side, the anterior cranial fossa is formed by the orbital surface of frontal bone and lesser wing of sphenoid bone. This lesser wing of sphenoid bone forms the posterior border of the anterior cranial fossa on either side. On each side, the fossa is limited by the frontal bone in front. So moving on to the features of the midline of anterior cranial fossa, we could see a sieve-like plate, a plate of bone having holes or perforations in it. This plate is called as cribriform plate of ethmoid, cribriform plate of ethmoid bone, which forms the roof of the nasal cavity. These perforations transmits olfactory nerves or filaments. If we see the midline of the cribriform plate of ethmoid bone, we can appreciate an upward tooth-like sharp projection called as crista galli. This is crista galli. So crista galli means corkscrew in Latin. Anterior to the cribriform plate of ethmoid bone, there is a deep depression called foramen cecum. So this is the foramen cecum. Cecum means blind. So it is the blind foramen. Occasionally, if patent, an emissary vein may pass through it. What we are seeing in the midline elevation of frontal bone from its posterior is the frontal crest. This is the frontal crest. This frontal crest and crista galli gives attachment for the fox cerebri, that is a dural fold. If we closely watch the anterior end of the cribriform plate of ethmoid bone, we can see anterior ethmoidal canals. Anterior ethmoidal canals which transmits anterior ethmoidal nerves and vessels. Similarly, there are posterior ethmoidal canals also, and along the margins of the posterior margins of the cribriform plate, we may see that. So these canals, that is posterior ethmoidal canals, transmits posterior ethmoidal vessels. So posterior to the cribriform plate, we can see a smooth surface, bony surface, where the ethmoid bone articulates with the sphenoid bone. So this area is called as the jugum sphenoidale. This is called as the jugum sphenoidale. This smooth jugum sphenoidale is limited posteriorly by a sulcus, that is a faint sulcus called as sulcus chiasmaticus. Now we see the sides of the anterior cranial fossa. It appears to be very irregular. If you see here, the bone appears very irregular, and this very irregular impressions are formed by the sulci and gyri of the cerebrum of the brain. So posterior border is related to the lesser wing of sphenoid bone, and is this lesser wing of sphenoid bone is related to the, and this border of the lesser wing of sphenoid bone is related to the sylvian sulcus or lateral sulcus of cerebral hemisphere. and this is also related to the spinoparietal sinus, that is one of the dural venous sinus. So the lesser wing of sphenoid bone medially ends as a tooth-like sharp projection, that is a small projection called as anterior glenoid process. Anterior glenoid process. The anterior glenoid process, this gives attachment to the free margin of the tentorium cerebelli. So that's all in this video. We will see the middle cranial fossa in the next video. Thank you.